Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, February 19th. Welcome to you, and welcome to Ed Brubaker, our Living Branches President and CEO. Hi.
Good afternoon, or I guess it's good morning, technically.
Yes, we're ahead of
since
schedule.
we're filming this morning. But yeah, it's time moves on. March is very soon will be here, and that's, I think the infamous date last March was what, March 12th, when we were in a meeting and Governor Wolf was shutting the state down for what we thought would be about 2 weeks.
Well, here we are. Let's start, I guess, with a roundup of COVID cases on our campuses. And happily, we have only one to report, and that is a staff person at Souderton Mennonite Homes who fortunately knew they had been exposed at home, and so they had not been to work. So the fact that they are now testing positive does not impact our campuses. So at this point, really, all healthcare, personal care, memory care is considered green.
Mm-hmm. No, and that's an excellent place to be. It could change again in the future, but we are pleased that we're at that place now.
Yeah, definitely. Well, let's see. Let's touch on, maybe let's give a vaccine update. We've been doing a lot of clinics lately. We've got our official Friday vaccine shirts on.
Yeah, and we have numbers for staff members, and we've been tracking that weekly during this time of the vaccine, and Human Resources is going to track it going forward. But we have right around just a tad over 74%, but call it 74% of our staff that have either gotten the vaccine or gotten one dose or have committed to get the vaccine. So it doesn't mean that they're all, 2 weeks past the second dose, which is our goal is to get above 80%, which is, I would say, a lofty goal compared to what we're seeing in the industry, because frankly, there's places in the industry that I was hearing 30%, 50%, 60%. So to be at 74 with a goal of 80, I think is good. Yeah. So we need to celebrate that, but we also have challenges, particularly in the caregiving areas where we want staff to even get up to 74%. So we have some work to do, but we're very pleased that we're where we're at currently. Residents, on the other hand, are probably anywhere from 90 to 100%, depending on the facility. We're still working on getting that exact data. But that's kind of the range that we're in. So that is tracking with, we are higher than most across the country, but frankly, it's tracking with, more residents are typically in facilities getting the vaccine as opposed to staff. And we won't go into all the details, but as you look at what residents have experienced over their lifetime, some of the questions about vaccines today, it kind of makes sense that there's maybe a generational difference. It doesn't change the fact, though, that we are strongly encouraging, recommending, and looking to our staff to do that. And at some point, after it's out of the EUA, depending where we're at, it may well become required.
Yeah. Our question today from a resident is actually about vaccines. And that question is, if I am vaccinated, does my vaccine protect me, or does it also protect my friends who are unvaccinated?
Yeah, and that's a very interesting question. And as we were talking before the filming, it can come back to the masks, and your mask protects you and your friend's mask protects them, or vice versa, whatever it is. But the point is, that's where it could have come from. The challenge is we don't fully know, because as things that we've read, things I've read, would indicate that the vaccines have been shown to have an excellent efficacy. The two that we're using in the United States, Pfizer and Moderna. I mean, to be at 95% is really unheard of, and we should celebrate that fact and be ecstatic that that's where it's at. And I'm really pleased with that. Having said that, my understanding is their testing of the efficacy was more about what did it do for the person vaccinated? Like, did it reduce the severity of the illness? Did it reduce hospitalizations? Did it reduce the fact of whether they got COVID or not? So that's what they were studying. My understanding is they don't know as much about did it prevent that person from being infectious to others? And that will continue to be studied over time. We would love to have an answer today, but that's the only reason people are hedging, physicians and other experts are hedging, because it wasn't part of the testing that was done about the spread to others. Having said that, other things I've read too is that we are underselling the success of the vaccine because of the hedging of the bets that we're doing. So we understand why we're doing it, but all things so far would point to the fact that the vaccine is excellent and the ones we're using are excellent, and we need to get people vaccinated. Because the best way to get this reduced is to get people vaccinated so they're not susceptible to the virus, and then the virus doesn't have people it can affect. It can't live out there on its own. It needs to have a host. And if we can eliminate the hosts that are eligible, that's what the point of the vaccine is. That's what herd immunity is all about. And so we need to keep working at that, because it also, if there's a reduction in the host, that also helps prevent variants from spreading as well. And so we need to get ahead of this. Very important for us to get vaccinated when we can. I realize the supply is a challenge too. And so that's not something we can do anything about, but we can do something about getting it when we can. Just very important to do that.
It's there's always a temptation to take one small set of information or small set of data and then extrapolate out to larger circumstances. But we did have, which I know we shouldn't do, but I still do all the time. I know we had a situation recently in Oakwood Court at our Dock Woods campus where we had just literally, I think the day before, given residents their second round of the vaccine. And then we had someone test positive. But no one else got it. And so I think it may be easy for residents to look at that and say, oh my goodness, that must mean then that I'm protected from spreading it to anybody else. So I can go and be with my unvaccinated friends in any way that we want to, but we shouldn't make that jump.
Yeah, that's right. And we just don't fully know that, but that is a very, very positive thing that we were talking about in CRT, early on in this, when we had one person, our hearts would just sink to the floor, and we, sprang into action. We still spring into action, but we also, I think, feel way more confident that we can control it. Having said that, it's also changed, and so it may not be quite as deadly as it was in the beginning. But there's so many, we have monoclonal antibody treatments. There's so many more ways we can combat this. So just with anything in life, once you've dealt with it for a while, you become knowledgeable, more comfortable, and more confident that you can move this thing forward. And so that was great news. We had this person that was positive. She was quarantined, but nobody else turned up as positive, which is really great news.
Yeah. Now, the challenge, of course, is that we still have to do our 14-day quarantine, and we still have to test all residents and staff. So one person still brings life to a halt, if you will, in that area. But if it doesn't keep cascading, at least we can get in and through it in a reasonable amount of time. And now I think in part because we are feeling a little bit more confident about that, we've been able to do more with opening up some of our restrictions. So we had a meeting yesterday in our coronavirus response team meeting where we talked about residents in healthcare and personal care at Dock Woods and Souderton Mennonite Homes, if they've been vaccinated and they want to go and eat in the cafe or bistro on campus, that they'll now be able to do that. We talked about in residential living, we can start doing entertainment again in larger groups of up to 25 in large areas, as long as we practice social distancing. No wind instruments, or singing, but still, piano would be okay. So slowly, some things are happening to get a little bit back to normal.
Yeah, that's right. And always in the back of our mind when we're opening is like, wow, one person can shut this down all over again. And that is true, but it is still worthwhile to move in those directions. And I know we want to talk briefly about some things we're doing at the Willows as well.
Yeah. Maybe to say that for pandemic restriction, the big thing that will be coming shortly is that we made the decision for residential living that we will reopen for visits in residential living 2 weeks after the second clinic for vaccination. So at Dock Woods, that will be March 1st. At Souderton, it will be March 15th, provided nobody tests positive in between now and then. But it's nice to be able to make that decision, and we make it not only taking the vaccines into consideration, but also the continuing declining positivity rate in Montgomery and Bucks counties.
Yeah, that's exactly right. We're not just thinking about the vaccine, but the rates are coming down. I think partly because of the vaccine, but partly because of other things that, people got the surge over Thanksgiving and Christmas out of their systems. And all evidence would point that maybe not most, but more people are staying at home in January. And honestly, it's easier in the month of January, and certainly with the snow in February, it was easier to stay home and binge watch Netflix or whatever people do. But, those things are impacting the rates as well. And so the rates are coming down, not in huge increments per week, but they are sliding down. And so Bucks County is now under 10%, which is good. Montgomery County is pushing towards 7%, which is very good. But we want to keep driving those rates down because it wasn't that long ago that we were under 5%.
Right.
And I remember in October, we were watching those rates because of the testing impact it had on us, and watching, oh no, it's not going to go above 5, is it? Oh no, is it not going to go above 10? And then we've been above 10 for a while, and now we're just creeping back down again. So we need to keep those things in perspective, that it's much better, but frankly, it's still not where we were last October.
Which is hard to remember.
That's right.
Yeah. Because it feels better right now.
Right. And I think a big part of that is the vaccine.
Yeah.
That gives us hope for the future.
Yeah. Well, let's talk about the Willows and what we have going on there. One of the nice things about the Willows campus is because it's smaller and contained, it's a great laboratory to run experiments. Which maybe I won't say that. That sounds terrible. But how about we are starting a pilot program there that we are then looking to spread out to our other campuses. So why don't we talk about that?
Sure. And you've been very engaged with the details, and at some level of detail, we can figure out how deep we want to get in here, but it'll be on our website too. But it basically allows that people can have guests, and there's certain parameters and certain restrictions. But it's different than the Compassionate Caregiver Program because it doesn't have some of the restrictions that program does. But we really feel it's just so important to have those human connections with family and friends. And so we are, as you said, piloting this at the Willows. And if we have good success there, then we'll take it to the other campuses as well. But we just feel it's important to try these things. Yes, there could be failures along the way, but it's still important to try to keep moving us in those directions, because it's important for our existing residents and their own emotional and mental health, but it's also important so we can welcome new residents in also, because that is very challenging right now. So yeah, it's a great opportunity. And I guess I would just like to say, before you maybe say a little bit more of the details, there was some great work that you and Monique and other members of the Willows, Jen Durstein and other persons there did to pull this together and pull the details together. And I was just personally reflecting on that the other day too, of this has been kind of maybe one of the longest and shortest years in our lives in many ways. But there has been so much unbelievable work that's been done on all these kinds of things. I mean, the listeners of this video, I don't think have any clue as to how many details have to be thought through just to be able to do a pilot at the Willows, or introduce compassionate caregiving, or whatever those things may be, because you have to look at the regs, you have to look at the logistics, you have to look at the signups, you have to look at this, and what happens if somebody tests positive, and there's so many details. And we introduced a testing team the other month, and Lori Borglum was involved with that. And there's been so many people. Murray Sheeran has been so involved as infection control. So many people that were doing things that these were not part of our normal duties a year ago, let me tell you. And granted, other things have been set aside, but there has been just huge amounts of work that have been done. And I just want to have a shout out to you, but also others that have really worked hard, because it's about our passion for the residents and our passion for the work and making the lives as best they can be during this pandemic. That's just so important.
The thing that's been, I think, perhaps maybe for me, one of the most interesting things is, we don't typically wing it. Like, we like to really think about how are we going to do this. And we pulled this guest program together in like 2-3 weeks. And there have been so many things like that we've kind of learned how to do throughout this pandemic. Is, okay, let's buckle down and figure out how we're going to make it work. And people just come together. Melanie Kohler, our director of IT, one of the most challenging things to figure out at the Willows is how are we going to get people into the building after hours? So it's such a little thing you don't even think about, but that took a lot of doing to figure out how we could make it happen. And everybody just pulls together and says, all right, let's figure it out.
Yeah, that's exactly right.
Because we want residents to be with their families again. And so at the Willows now, what we're introducing with this guest program is that residents can designate up to 2 people to be their guest, and that those persons have the ability to meet with them in their rooms, to visit in the rooms. It doesn't have to be in the common space visiting area. That'll still be in play, so anyone can have guests there. Or have visitors there, but they will be able to have guests in their rooms again. And I really think that just makes it feel more like home again. And I think that's part of the reason that we're so excited to be introducing that. So we emailed this out to family members at the Willows, so they've got all the information. People have to be tested regularly. They've got to provide documentation, all of those things. But speaking of Lori Borglum and the testing clinic, we are very pleased that we were able to offer guests the ability to be tested through Living Branches so they don't have to go somewhere else.
Yeah. And yeah, you might want to just explain a little bit how this compassionate caregiver program, how that connects to the guest program, because we're in this all the time, but for the people looking on, they might say, well, isn't that how the compassionate caregiver program works? They're allowed 2 people, et cetera, et cetera. And so maybe you want to just have a brief comment about that.
The main difference between the compassionate caregiver program and the guest program is that per state regs, in order to qualify to have a compassionate caregiver, you have to have a health reason to do so. So the regs, I believe, say that the person needs to have seen exhibiting a significant decline. And so the guest program, then, anyone can have a guest. And there's no need base, if you will, for that. So we have those 2 things going, and then we also have our standard visiting. So there are lots of opportunities now for people to get back together, which is great.
Yeah. So does that mean that the compassionate caregiver program theoretically might go away and be substituted by the guest program at some point?
It's a possibility. Right now, one of the other differences between the 2 is that the compassionate caregiver can come every day. In the guest program, they're coming twice a week, and there's 48 hours between visits. Murray is the one who suggested that, I believe, and that will allow, if a person is infected, that will allow time for the virus to brew. And so hopefully they won't be on campus when they're infectious, and we'll be able to pinpoint that.
Yeah, that's right. So yeah, that's a helpful explanation, because there are differences and distinctions between the 2, but I'm sure the viewing audience may get confused when we talk about this thing, because we're dealing with it all the time.
Yeah.
So
yeah, and the big thing to know, of course, is that we're piloting it at the Willows, and then we'll be bringing it out to the other campuses once we ascertain that it doesn't really increase the risk of infection. Because, of course, now we have to count the guests and the compassionate caregivers sort of in our ranks for infection control, and meaning if any of them test positive, we're shutting down again.
Yeah, that's right. And it just makes it so important that people involved in compassionate care or the guest program or whatever, help us make sure these are successful programs. So if you haven't been vaccinated yet, do the right thing when you're at home. Don't go to places that are unsafe. Don't, I haven't been in a restaurant. We've gotten takeout, but I have not eaten in a restaurant in the past year. And I'm not sure when I will be. And I'm vaccinated, and I'm 2 weeks past. So that would be an example of something that I personally consider to be one of the most unsafe things you can do, because you are on mask, you're with multiple people, you don't know what they've done to their HVAC systems, if anything. We have halo systems and UV lighting and HEPA filters and all that kind of stuff on our buildings. And so we need to ask those compassionate caregivers and the guest program people, be safe. As the Hill Street Blues or whatever, used to say, be safe out there, folks, because the power of one. Yeah. If one of you has a problem and are positive, and we look through contract tracing to say that this impacts, we got to shut the facility down. Yeah. So these things are important to do, but they're not without risk. So it is all of us working together yep. to protect each other. And we have to do that because we're not anywhere close to our society and the United States getting vaccinated. But it's so important for us to do these things. Yeah,
I couldn't agree more. So, final thoughts?
I think that probably was the final thought.
I liked it. All right. Well, thank you. And thank you to our audience. And we will be back again in a few weeks. Thank you.